Hi everyone, my name is Dr. Arif Muhammad. I'm a specialist in emergency medicine. I have done my MBBS, MEM, and MRCEM from Royal College of Emergency Medicine, UK. In this video, I'll be discussing some ECG hacks that will be useful in the ED. So, we have a 40-year-old woman with no previous medical history presented to the ED with 4-hour history of chest pain. The pain had been intermittent for 1 week, but she attributed it to something she had eaten, and an ECG was recorded at the triage. So this is the ECG that was taken the ED. The ECG looks pretty normal, but there is no significant STT changes or in severe reciprocal changes. So what we'll do in a normal scenario, so we will either wait for the troponins and we will score with a TIMI score or heart score, and we will discharge the patient. So the impression of the ECG looks like it's a sinus rhythm with some non-specific T wave abnormalities. But unfortunately, the ECG is diagnostic of an LAD occlusion, also Stemi. It meets the Stemi criteria. There is a 1 mm ST elevation in lead V1 and there is a 1.5 mm ST elevation in lead V2. And we also have some hyperacute T waves and ST depression in lead 2 and AVF. So we can appreciate the ST elevation of 1 mm ST elevation in lead V1 and 1.5 mm ST elevation in lead V2. And the hyperacute T waves also we can identify in this ECG. These are hyperacute T waves. These are hyperacute T waves. So what is a hyperacute T wave? Hyperacute T wave is a T wave with an amplitude more than that of the corresponding QRS complex. So these hyperacute T waves are typical example of Stemi equivalence. So if you get a hyperacute T wave, you should be suspicious of a Stemi. So these are the hyperacute T waves that we usually miss in our AD. And there is also a minimal ST depression in lead 2. There is a minimal ST depression in lead 2 and lead AVF. That also you can make sure from this ECG. So guys, these are very important Stemi equivalents that are high chance of missing these changes in the ED. So if you get such an ECG, you should inform the cardiologist and you should shift the patient for emergency cath lab. So I hope this video will be helpful for your emergency practice. Please do subscribe and like and share my channel so that I can post more videos in my